Good afternoon. My name is Abby Kosan, and I am the Executive Director of Kupona Foundation, a U.S.-based nonprofit committed to empowering people and communities by improving their access to quality healthcare. We do this by working directly with our sister organization, CCBRT, a Tanzanian organization and the largest provider of disability and rehabilitative services in the country, as well as a key partner to the government in the fight to improve maternal and newborn healthcare. Kupona's role is to mobilize resources in support of CCBRT's life-changing work and to elevate the challenges and opportunities faced by CCBRT, which is why I'm talking to you today as part of our Social Innovation Prize video submission to talk about what healthcare providers in low-resource settings can learn from the Toyota production line. To briefly restate the challenge that I talked about in the previous video, an estimated 5 billion people globally lack access to the quality, safe surgical care that they need. This is caused by a number of challenges, including insufficiently trained healthcare providers, inadequate infrastructure in the healthcare system, and the high cost of healthcare. Compounding that challenge is rapid population growth, especially in urban centers such as Dar es Salaam. These challenges create a burden on organizations like CCBRT, which are expected to fill a significant role in the healthcare system. Many of these organizations have grown from having been small community-based organizations. Today, CCBRT runs a 200-bed hospital. So they were faced with a challenge both in terms of demand, in terms of maintaining the quality that they needed to, and in terms of helping to change the culture in the organization to identify problems and make them visible in order to improve them. This is where lean continuous improvement comes in. CCBRT's lean journey began in 2012. They began by starting to roll out training about the principles of lean across the organization. While they saw some progress, that really wasn't making change stick, or they weren't seeing measurable results that they had hoped to see. So instead, most recently, they took more of a deep dive approach, sort of the inch-wide, mile-deep approach. The reality was in 2016, let's say October, they had over 500 patients coming through the gates of the hospital every single day. They were faced with the reality where they were turning away up to 80 patients a day. This is completely unacceptable, especially in the context of a country where about 65% of the population lives on less than $1.25 a day. Patients come from all corners of the country for services, and many have traveled for hours, if not days, to receive the care that they need. So CCBRT recognized there was an urgent problem, and they took the lean learnings that they had been implementing over the years to take a deep dive approach into the eye outpatient department. What they did was working with the senior management team, middle management, all the way to the frontline healthcare workers interacting with the patients every day to identify the challenges and the bottlenecks, identify improvement opportunities, and ultimately to redesign the entire patient flow and process in the eye outpatient department. They contacted the government, they contacted patients, and they shut down the eye outpatient department for an entire week to change the process flow and make some infrastructure improvements. They saw tremendous results, a 72.5% improvement in the number of patients returned without service, and more than 21% more patients seen every day. This is really significant. From an outcomes perspective, the way that they're looking at that is by what CCBRT calls their true north. With the client or the patient at the center, they look at quality and safety, client satisfaction, staff engagement, and financial responsibility. Underneath that, there are indicators built out, things like patient wait time, infection prevention or infection percentages, and profit margins. They've got identified value stream leads in each of the departments, which would then be developing those indicators further, working with monitoring and evaluation. Looking then at the team that makes this possible, the CEO is fully bought in. The director of the disability hospital and the director of the maternal and newborn healthcare hospital are fully bought in. There is a lean management consultant who's been working closely with the team across the entire duration of this initiative. And they have, all members of the senior management team have been through training specifically with Dr. John Toussaint, a leading really leader and pioneer in moving lean into the healthcare space. We would spend the $10,000 prize money to take this to the next stage. We're now in the early implementation stages, and what we're looking to do is roll this out across all of the clinical departments. We need to make it stick. We need to establish a central improvement office, which would then work with the value stream leads to make this part of the organization's culture. And perhaps most importantly, what we would do is to continue to contribute to the evidence base in order to allow other